Our next guest, ladies and gentlemen, was a professor of Johns Hopkins University. And now he plays a leading role at WHO, the Health Organization of the United Nations. And they have a very, very ambitious program for digital health worldwide. And it has also to do, Alain Labrique, with standardization, of course. Please, the floor for you. Alain Labrique, ladies and gentlemen.
Wow, wow, wow. What a wonderful morning, and what a hard act to follow. I'll have to get you back on that one. The Honorable Minister followed by CK, and when I looked at CK's profile, it says you're a digital health evangelist, and I used to call myself that for many years before I went to WHO. But boy, have you lived up to that moniker. Really, what an inspirational speech. But it's such a privilege to be with you today, and thank you for having me. Let me make sure I understand how this technology works. So I'm Alain Labrique. I'm the Director of Digital Health and Innovation at the World Health Organization. And I've been there for nearly 2 years now. But first, I want to thank the organizers for the opportunity to join you all here in Maastricht. It's a pleasure to really be among so many fellow geeks and champions of digital health and standards and interoperability. I think that's really the theme that has emerged already in this short morning. So I think it's important to note that we find ourselves in a world that has changed. We could write off these last 4 years as a horrific chapter in global health history. Or we can look to honor the tragedies of the pandemic by lifting out the important lessons that we've learned. Around the world, necessity has forced us to break out of policy and practice boundaries to get information and care to those who need it the most. And I believe this has led us to a digital inflection point. And it's one that we at WHO feel every single day. Countries are coming to us and asking, how do we move out of a state of digital fragmentation, of digital experimentation, towards this word that you've already heard this morning of digital transformation of health? Now, the pandemic has driven the state of play for digital health to one of a possible future to the reality of our present. A present where in India, every single day, more than 300,000 telemedicine calls are made each day. Where in Rwanda, 2.9 million citizens are registered in a universal health coverage digital platform. And where 1.6 million people in Zanzibar are part of a national digital health system, connecting 100% of all community health workers in that country. Ladies and gentlemen, digital health is at scale, and governments are moving from digital experimentation to digital transformation. Now, given the centrality of climate change to any discussion on global health, let me quickly share with you this exciting data that's just coming out from India, showing estimates of about a 20-kilometer averted of fossil fuel transport when telemedicine visits are done. And you saw just a moment ago, that number ranges on a daily basis from 320,000 to about 500,000. But since 2019, this translates to about 4.4 billion kilometers of fossil fuel travel that's been averted. So digital health can also be a climate change intervention. The mobile phone digital revolution that you see here occurring over the past decade and a half has transformed the globe, with the global south leading in this leapfrogging technological shift, which is not surprisingly similar to the well-known map of maternal and neonatal mortality burden. My journey in digital health began asking whether this could be an overlap of the challenge and opportunity. Could we stem the tide of senseless maternal and neonatal deaths through the application of digital interventions in these settings? It's here in Bangladesh, where I was born, shortly after the horrific War of Independence, and my mother delivered me in a barely functioning post-war chaotic hospital facility. We both nearly became one of those statistics I was just sharing with you. I, probably because of my large head, through obstructed labor, and my mother from postpartum sepsis. So I remember my dad telling me stories of how he biked from clinic to clinic just to get enough antibiotic doses to save her life. So digital health for me is very personal. Because in Bangladesh today, despite major achievements in reducing maternal mortality, the rate of under 5 mortality remains around 30 per 1,000 live births. It's a number that's hard to grasp, except when you realize that it means nearly 300 children dying per day. That's multiple aircraft crashing every week without a single headline to show for it. So my career began asking, could we develop digital systems able to support women delivering largely unassisted at home, disconnected from the formal healthcare system? Could we support overwhelmed frontline health workers who struggle to deliver services across vast rural areas of these countries with few incentives and with very rudimentary technology? And over the last decade and a half, many of us here in this room and outside have had similar epiphanies, leading to a proliferation of digital experiments. In many countries, this enthusiasm drove a state of pilotitis, or e-chaos, that you see here in the famous map of Uganda, just before the 2011 government moratorium on new digital health or e-health experiments. And this is because few, if any, of these projects were standards-based, interoperable, let alone known to the government. So WHO has for 20 years worked to put government in the driver's seat, developing clear strategies to invest in digital solutions as part of a broader health system strategy. Over 75% of countries today have clear national digital health strategies. By convening the world's experts, we distill evidence, we promote open standards and interoperability, and develop guidance and guidelines on how to plan and develop architecture-based national digital health strategies. WHO serves as the secretariat for the global strategy on digital health, something that many of you in the room may not be familiar with, but it's a member state document that 194 countries came together and articulated as a shared vision of what they wanted to accomplish with digital health. It's helping to ensure that we learn from each other to plan these strategies and access high-quality building blocks without reinventing the wheel every time we want to solve a problem. The blueprint may seem a little complex, but it's based on lessons that we've learned over the last decade. From left to right, national health priorities are the things that should inform a national digital health strategy. These have to be aligned with the maturity of where a country is in the given point of its evolution. An investment roadmap and architectural blueprint encourage investment in digital public infrastructure, something we heard the Honorable Minister talk about repeatedly this morning. Open, standards-based, shared national services and applications, policies, training, and governance. As Minister Helder said, having people and institutions designated to be the custodians of digital transformation is absolutely critical. If nobody's steering the bus, we don't know where the bus is going. And so it's really critical that the government sets the rules of the road, sets the standards, which then fosters an environment where private sector, public sector can all thrive together towards shared common goals. This is a roadmap that's being now followed by countries around the globe. I'd like to briefly share with you a few projects that we're working on to promote global resilience and a few tools, building blocks, and partnerships that are helping countries in their transformation journey. You've heard from CK about efforts that are being driven to help patients on the ground, and at WHO, we're focusing on that large-scale architecture, helping systems to thrive within that architecture. First, in June of last year, we launched the Global Digital Health Certification Network. This is a vital piece of global health infrastructure, empowering people to carry with them open, standards-based, verifiable personal health records. It's a lot of words, but what does it mean? It means that you can carry with you your personal health records as the owner of your data. Imagine the next time you need your child's immunization card, or like the ministries of Indonesia and Malaysia are working on right now for this year's Holy Hajj to Mecca. They can have their own health record at their fingertips to share when patient care is needed. we're leveraging the International Patient Summary Standard, or IPS, which the Netherlands has been a big champion for as part of this infrastructure. Building on our experiences developing standards for the exchange of COVID test results and vaccine certificates, WHO is now serving as the public key directory, a sophisticated phone book for this global network. It's exciting to share that as of today, we have 77 countries around the world connected to each other through this network, effectively supporting 1.7 billion people on the planet, expanding to any of our 194 countries who want to join as members. Now, you can learn more about this through this magical collection of pixels, which WHO is working to enable people everywhere to be in control and have access to their own health record wherever they need it and wherever they may be. Next, I want to mention the SMART guidelines. This is an effort to improve the use of evidence-based clinical and public health guidelines. It's the bread and butter of what WHO does. We bring smart people together and we put out guidelines on the best practices for different diseases and health conditions. And what we do is we transform these large volumes of very complex text into machine ingestible DNA, the FHIR, CQL, ICD-coded formats, which helps to spur local production in Ghana, in Kenya, in Bangladesh, by providing the digital DNA of guidelines that enables country entrepreneurs to develop local standards-based solutions. There are 5 phases to each SMART guideline, and I'll just quickly walk you through them. This is an example of the guideline for pregnant women supplementation by iron folic acid. First, we transform this into a digital adaptation kit that helps to ensure user-centered design. One of the great questions from the audience this morning was, how do we ensure that these are user-centered tools? So this creates personas, business processes, decision logic, and indicators that helps lower the bar of entry for entrepreneurs in those countries. Detailed informatics workflows help conceptualize the digital solutions by role, and computable guidelines provide CQL logic and data requirements in complex JSON and XML formats. Here we see how the recommendation for anemia on the left is converted into software code on the right. And by WHO making this available, we lower the risk of programming errors that can cause harm to patients. And our local software collaborators can focus on building better user-friendly tools than sitting there and trying to interpret complex medical guidelines into code. It's also important, as the minister pointed out just a minute ago, that it's also about better data. What this does is help create a future that's AI-ready with better, stronger sources of primary data. Now, by implementing standards-based solutions at a country level, like India, Indonesia, and Kenya are doing, you avoid the technological debt of building custom adapters to connect all of these disconnected systems. That was another great question from the audience this morning. And what you do is you create an ecosystem that's very much like a Lego building block approach, where national interoperable systems allow new systems to emerge that can plug into each other across a backbone. It's also an opportunity to reimagine how health systems should work in a digital age, and this is very important. Because digital transformation is not just about digitalizing broken analog systems. It's about rethinking how we deliver care in a digital age. And again, there's another magical portal. If you want to hear more about SMART guidelines, feel free to click here and go there. Now, moving along quickly so I don't run out of time, we're excited to have leveraged in the last year WHO's convening role to bring together 2 platforms for global collaboration, reducing the risk of e-chaos at the country level. First, the global initiative on AI for health that builds on the success of the AI for Health focus group that's been around since 2018, draws inspiration from about 150 experts on AI from academia, industry, and government, distilling best practices and making these available to governments around the world. As CK said, it's not about artificial intelligence, it's about augmenting and assisting people through intelligence. Our recent guidance on governance of AI large language models for health, launched a few months ago, has already been downloaded over 54,000 times, with all of these resources being accessed frequently. So they're all freely available on our website, and I hope you'll take the opportunity to go and visit them. We'll make these available to all of you after this talk. The WHO in 2021 issued the first ever guidelines on AI tools for triaging TB patients using AI and X-rays. And now we're working at using this technology for many other priorities, from diabetic retinopathy to supporting community health workers with voice-based helplines. To address the growing fragmentation in digital transformation efforts around the world, in February, we launched the Global Initiative on Digital Health. And we spent about a year listening to countries around the world for what they needed to encourage that transformation, co-creating with Brazil and India the future of what this platform could be to help countries move forward. The GIDH, or Guide, helps us to accelerate the global strategy on digital health, which I shared with you earlier. Guide is based on 4 pillars, the first 3 focusing on optimizing countries' ability to identify what are their priority investment needs, and then providing them with the tools they need to undertake digital transformation. So I invite you all to work with governments, if you're working with governments around the world, to input your data into the Global Digital Health Monitor. This is the platform we use to measure maturity, where a country is right now in its state of progress in digital health, and to understand where appropriate investments need to be made, allowing us to measure progress over the coming years. Innovators and developers, and I hope there's many of you in the room out there today, we invite you to register your projects, like we heard from CK about a marketplace, in the Global Digital Health Atlas. This enables countries to not reinvent the wheel and to encourage collaboration. Now, I will say that none of this exciting work is done alone, and I've met already this morning many partners who work closely with WHO, helping us to realize this country-focused vision. We acknowledge the support of many partners who are helping to move this forward, and I'll end this with one call to action. Please download a copy of the Global Strategy on Digital Health. We have 1.5 years left. We need everyone's help to achieve the goals that are articulated here. And let us know what you are doing to address the goals that countries have asked all of us as digital health innovators, thinkers, and entrepreneurs to invest our efforts in. More importantly, let me just take a moment and ask you to turn to the person next to you and just say the following words: the work you are doing saves lives. Go ahead. You can also say it in Dutch if you want. But this is really important. It's really important because we're not just chasing shiny objects. We're not just doing technology for the sake of technology. At the end of the day, what you are doing, whether it is helping promote interoperability, whether it's developing new standards, whether it's developing a user interface, that work saves lives. Thank you so much. Digital health is global health. I appreciate your time.
Thank you, Alain. Very inspiring. Thank you so much. Very inspiring. Please stay on stage for a moment. How mature is the Netherlands? Because I was wondering, talking about maturity, how mature is the Netherlands according to all your standards?
I will encourage your audience to go to the Digital Health Monitor and find the Netherlands to see where the gaps in maturity might be. I think one of the challenges in answering that question is that countries that have a long legacy of digital systems where that predate the existence of government regulatory structures or government leadership often have a much harder time progressing into a state of digital transformation because there's so much legacy to bring with you.
Yeah, so our honorable minister said, we need a little bit more, sorry for the word, policing. That is
I think sometimes you have to
wonderful.
break things to build them back,
yeah.
right? And so I think there's a realization around the world that, as you said, monolithic systems is not the way of the future. we need to encourage entrepreneurship, creativity, innovation, and for all that to flourish, one solution to solve all the problems is not the way we're going.
I was wondering, you were very optimistic about the CO2 when you mentioned less kilometers. But yesterday, if I heard keynotes about the use of data and energy, it is staggering. It's so much terabytes, I can't even pronounce it.
Yeah.
So I missed it a little bit in your speech.
So
How do we solve that?
it's a great question, and I think we have to wrestle with the double-edged sword of innovation costing energy, but also we have to keep pushing forward the agenda of greener, more efficient energy sources to drive the future of computational systems. So it's absolutely critical. We can't continue to go the way we're going, whether it's the way we have meetings, the way we interact with each other. Every time you take a picture of your cats dancing on the floor or store a picture of something,
it goes into the cloud.
It goes into the cloud, it takes up CO2, so be responsible about cat videos.
Please.
And that's not official WHO guidelines. I'll get a call from my DG saying, why were you talking about cat videos?
You're also a person. U bent.
My name is Wenke Vastwender from Roche, and thank you for your inspirational speech. And referring to last year's WH resolution on diagnostics, what role does diagnostics plays in this digital transformation?
Yeah, absolutely. And I think it's a great question, and it's also thinking about self-care and patients being at the center of their own health journeys. I think as we think about diagnostics and we think about the role that technologies can play in democratizing access to diagnostics, the use of diagnostics at home, the shifting trend that we're seeing towards virtual hospitals, so the idea that your first encounter is a virtual one at your convenience in the middle of the night when your child has a fever of however many degrees, that's when you need healthcare, and that's when you need access to diagnostics. And so I think we're seeing a lot of breakthroughs in a lot of technologies, including diagnostics, and how they're married to the digital technologies. It's also about promoting standards-based interoperability. So all of these diagnostic platforms, all of the medical technologies that we use are increasingly aligned to common standards. So it's not about whether you have a machine from one company or another company and they can't speak to each other. And I'm sad to say that I was somewhere in Europe yesterday trying to treat my mother, and two hospitals, part of the same health system, they couldn't even share her basic demographic information. And so, you know, I mean, we have a ways to go, but I think the future is looking bright. And as we say with AI and digital health, we may be frustrated now that things just aren't as amazing as we want them to be. But we're at to take the Gartner hype cycle, we're at the bottom of that hill climbing rapidly. So the future, I think, is very bright, but we have a ways to go before we get to the top.
Here's another question for you, Alain.
What we're doing here is thinking about how...
Annelies van den Berg.
Oh, sorry, Annelies van den Berg
I'll
from
let him meet
Patiënten
you.
Regie. We're thinking about how digital health can help quality of care throughout the world. That is what we're thinking about. What I'm thinking about is how do you deal with cultural differences in terms of quality of care, expectations of quality of care, where you want to standardize, and where's the input of patients, because we're in a time and age where we talk about value-added healthcare and joint decision-making and that sort of stuff, which I'm sure is not new to you. But, you know, as a director of the World Health Organization, I'm very curious about what your feedback would be.
Absolutely. No, it's a great
Good
question.
question.
Fantastic question. And let me say by evoking a conversation that I had 10 years ago in South Africa, where we were meeting with the Minister of Health and a bunch of private sector companies about sending text messages to pregnant women about the things they should know during pregnancy and the postpartum period. And we had the telephone companies wringing their hands about ARPUs and ROIs, and ARPUs are average return per user. And the minister stood up and said, you know, in South Africa, access to information is a basic human right. So we are going to make this a national program. And it was the first national program on digital health anywhere in the world that made every citizen of South Africa able to access Mom Connect, a service that provided text information, and now it's much more sophisticated AI-based tool. But the idea of quality of care begins with an educated and informed patient. So making sure patients have access to reliable, trustworthy, in-time information is the first pillar. The second pillar is what I mentioned with the SMART guidelines, making sure that providers have the most accurate, up-to-date treatment guidelines that they're following in order to provide the best care. And then the third, I think it was what one of you said this morning, sometimes the simplest solutions are the most impressive. And I often think the work that we're doing in South Asia in asking patients to call in or send a text message in after they receive care to rank or rate the quality of the encounter that they had received is a major breakthrough in actually listening to how the patient feels after that interaction has taken place. We've had phones in our pockets.
Inclusivity is very, very important.
Inclusivity is
also
absolutely
for the
important, but
standards.
listening to patients is absolutely critical.
Okay.
And having
Last
their
question
voice. Yeah, please.
from Safa Amadjoub from
Great
Saudi
question.
Arabia.
Thank you very much. This is Safa Al-Majdoub from Saudi Arabia.
Assalamu
Saha
alaikum.
Virtual Hospital, Chief Strategy Officer. I remember we worked a lot on different topics when it comes to international telehealth. However, my question to you, if you recall that sad episode during earthquake in Turkey, for example, where telemedicine played a major role. However, this will always ring a bell, like how, from a regulatory point of view, could support or align all member states to basically work together cross-border using or in the context of telehealth and telemedicine. However, how can we strike the balance between increasing access to those services cross-border without jeopardizing safety and security of patients? Thank you very much. And I know you're playing a major role in developing those guidelines at the moment. Yeah.
No, we actually just published a review with the Saudi ministry on the virtual hospital, so delightful to have you here. But I think two things. One is the Global Digital Health Certification Network looks to validate cross-border the veracity or authenticity of health information and documents. So one of the next use cases that we're prioritizing is cross-border telemedicine. How do you know that the provider who's treating you across a border because of language or cultural competence is someone who is qualified and authorized to provide care to you as a citizen of that country? The second thing, however, it goes back to the pandemic, and something that I think we learned around the world is that the biggest bottleneck in delivering technological solutions is not the technological solutions, it's people and policies. And when necessity came to the forefront, we saw that a lot of these policies that were actually not enabling policies, but disabling policies were lifted, allowing these things to move forward. And around the world, people experienced access to telemedicine for the first time. And we've now seen global growth in telemedicine use triple, quadruple, sometimes increase by over tenfold. And this experience is because we have taken a hard look at some of the policies. Imagine in some countries, there are still regulations on the books that say, by the hand of the treating physician, which automatically puts a whole class of treatment out of reach, because by the hand is legally taken literally. And so we have to take a careful look, not just at building an enabling future, but, as we talked about earlier, breaking down a disabling past and figure out what are the policies that are preventing us from using innovation responsibly to deliver care to everyone who needs it.
Thank you so much. Thank you so much, Alain, for
Thank you
your
so much.
wonderful
Lovely.
speech, inspiring.